Hi, it's Christina once again, and somehow I seem to have got my cat in this one. It's just jumped up on this counter as we're about to do some more red light, because I realize the importance of the red light, and I know how important it's been for me, but I didn't necessarily realize to the level that it would attract so much attention, because it really has. But you know, red light is far more involved than just the one red light that I would be suggesting that you use. The one I have is something that I've used for a while. Why? I used it for my eyes, the most important part probably of our life. I have macular degeneration, you know that. I had a cataract surgery, not the greatest, it's okay. And we got this sort of business with the dry eyes, but that's not so terrible. I can live and you can live with that. But what I really wanted to go on further about was the application, or application doesn't sound right, using the red light. Using the red light is pretty important because you don't necessarily need to have it too close to you. And you also, if it's on parts of your body, it's essential that you have it very close to you. I think we're going to move this cat away, it's distracting me. But what I want to say is that if you're going to do it with information. There's an awful lot of information out there on red light therapy, but I want to give you my impression, what it's done for me, because otherwise you see all this stuff, all these claims, all this and that. Does it really work? Well, as you know from what I said to you before, one of my eye doctors said that it had improved my eyesight by 20%. Okay, so we got that eye doctor. Then we got another eye doctor over here who does the injections, who doesn't really comment. He said my eyes are stable, but he doesn't want to know about red light therapy because it's not part of his background. You know, red light therapy's been out there for years and years, but not necessarily applied to where we are now. I have found, yes, it's been obviously helpful to me. Obviously, that's why I'm talking to you about it. And I need to help people with this because it's helped me. But it's also helped me with my hand. How about that? You put the red light on your hand, which I'm going to show you in a minute, and now that's skin on skin. And I do that every day for probably about 5 minutes. The need for that is that it's taken all the pain away. I'm flexible, I have nothing. And that's arthritis, right? We know about those lovely names. It's not osteoarthritis. That is another big deal. But it doesn't say that if you have it, the red light therapy couldn't help you. There's various sizes of red light therapy. I'll show you in a moment the one I use. But if you have an issue over your body, there's something called a full stack. Now that is pretty big, but you'd stand in front of it and it would work through all your body. I've not done that, so I'm not sort of promoting it. I'm just telling you that there are options out there, things that you can do. I suddenly find myself in a very interesting position that I'm actually advising you. Now, this is the red light I use, but there's also an issue of distance. Now, you have to do this, as I think I mentioned before, the red light goes on, you have to do it at arm's length. So it's like that, right? Arm's length, arm's length. It doesn't have to be that far. And then there's another question, should you have your eyes open or closed? Well, they kind of say actually open. So, and then when I do this, I do it in the morning. You have to do it, and the best thing is to do it at a window. So you've got the light coming into you, right? You've got the light of the morning coming into you between 8 and 9. That's called circadian rhythm. I didn't know these names, but that's the highest moment, or probably the best moment of your bodies to accept the help from the red light, or maybe other things as well. I'm not quite sure. I'm not a doctor, remember. I'm only telling you what I have learned and what fits me. So what fits me may not fit you, but it has to be in the morning between 8 and 9 for the eyes, not for anywhere else. And you've got to be at a window. You've got to be looking at light. When I do my wrist, I generally do it at night. Why? Because it suits my day better. And also, I've got a dog that's got a problem with his hip. So I'm doing it on the dog as well. I know it sounds a bit crazy, all this, but he limps. Does he limp as badly as he did? It doesn't seem to me that he does, but I don't know, you know, how can you do the progress? How can I can probably tell over 6 months if I can keep it in not getting any worse. You know what vet bills are? Vet bills are insane. I went to the vet with the dog. Okay, how much? $100 150 consultation, 150 examination. I come out with $300 and I'm not really that much wiser. And I thought, well, and she said, oh yes, you could use the red light. You see what I mean? You see where it goes into different areas? So, and also, I think the collagen of your skin is helped, because people have said to me, well, have you noticed the difference? You know, it's kind of hard to notice a difference on your skin. Yes, mine is pretty good. Remember, my age is not young, 80s. So collagen is something that's very important. Does this machine help me? I think it does. I think it does a lot of things that we're really not that aware of. And I'm not a scientist, I can't tell you, but you can read it up and see so much. And if you have osteoarthritis, that's a whole nother ball game. But think about this. Think about the red light. I mean, yeah, and it's an expense, but it's not out of sight. Now, the full stack is much more. Now, the company I go to, which is Red Light Rising, now that's going to be at the end of the caption, so you know where to go. What I like about this company is that if you ask them a question, they will answer you. Maybe not that day. I mean, I don't think it's AI, because the answers seem pretty what I've questioned you with, you know. Is it? And if it is, it still gives you an answer. All these other companies on Amazon aren't going to give you those answers. They might be cheaper. There seems to be quite a variety of prices. I can't tell you. This one comes from England. It's two guys that set it up in England. Yeah, it's expensive. It's £186, but you know, it's working. If I feel that my eyesight's got better, but I can't judge it exactly myself. I have no problem driving at night, but I'm not on a highway. During the day, it's okay. There's maybe a little bit of difference, but not that badly. But there were 3 products that I did want you to be sure that you use. These are Nutriseal, which is for dry eyes. That's an omega-3. Okay, I mentioned it before, but I'm going to mention it again at the end of the segment, so you know exactly what these are. 2 twice a day for dry eyes, but for your eyes in general. Then I've got my high-low drops that I would not be without. High-low drops are super, or you can have gel drops, one or the other. But again, I've been told to use these at least 3 or 4 times a day when I remember. And sometimes in the mornings, your eyes can feel kind of, what can I express, sticky, not as fluid, and that's why I always put it on before I sleep, and then I put it on in the morning. And then this other one, which is that kind of unusual one that I mentioned in last time, which is like a pad that comes in with a gel that you clean your eyes at the end of the day with. Because when you think about it, getting your eye makeup off, and I had kind of stopped a bit reluctantly with mascara, but I want it again because, you know, we want our eyes to show. We want our eyes to be the mirror of our soul. But what else can I say? You know, this is all part of keeping you energized. It's all part of keeping you current. It's all part of keeping you up to date. Don't give up on exercise. Keep walking, keep moving. Use light weights. Be energetic. There's no point me just telling you about your eyes and you don't do anything else and you sit in a chair. That is not life. Life goes on even with our age, And our age, you know something? It's there, isn't it? It sucks, doesn't it? It's a funny word to use, I know. But it's not something that is exuberant for our life. And I think, oh God, people ask me how old I am. I kind of hard to conceal. But you know, it is what it is. The eyesight, the red light, all these other things, I honestly feel they help me, and I want them to help you. If you go to Red Light Rising, by the way, I have to add, I get and you get a 10% discount. Now, I just want you to know that. So it's called Gregg Light Rising 100, but it's going to be at the bottom here. So you get 10% and I get 10%. So you can still go to Amazon. I'm not suggesting it's essential you do this, but this is the one I use, and I'm the one talking to you about it, right? And I hope through my history and what I learn, you know, I hope it helps you, because this is what it's about, isn't it? Life, we need to help each other. We need to kind of do what we can when it's needed. And I feel that all these things that I tell you are an addition to your life. And I feel they're probably the most important things that I've said to date. So with that, I would like you to subscribe to me. I'd like you to think about what I've said. And as I said, I think I missed out last time on getting all the comments of exactly where you get everything. But it's this for the eyes, Oh, D3, I keep forgetting that one. D3 is drops. We don't get enough sunshine, right? Maybe it's starting to come, but D3 drops are all helpful and enhancing. And once again, the dry eyes, that one, those pills, those are called Nutriseal, and they're omega-3s, but specifically for the eyes. And of course, once more, Halo drops or gel. So there you go. I hope I've told everything to you that you can actually remember, that I can remember as well. So it's from Christina. And thank you once again for listening to me. And let's proceed, and I'll look forward to hearing from you. And subscribe, okay? And ring that bell or whatever we have to do. Thank you very much. Bye for now.